Namaste and welcome to the next lecture of Clinical Ayurved by Dr. Mayuresh Agte. We were discussing Amlapitta and clinically we have seen the two group of patients in which according to Hetu 7 the Samprapti differs. First set of patient of Guru Snigdha Agdimandhyakar Ahar which initiates Agdimandya Amotpatti and repeated Hetu 7 causes fermentation of the food which has been taken by the patient, and then avipa, klamo, udgar, chardi, others etc. symptoms of Amlapitta are seen. This is a first group of patient and this is the classical samprapti which is described in the text. In the Hetu, as I said, Tishna, Ushna, Vidahi, Annapan are also Hetu as a Hetu of Amlapitta, and in that case, in my opinion, Agdimandya Amlapitta will not happen because all the Hetu itself are Agnivardhak. So, by my experience, I told you that when such patient with such Hetu 7 come to you, you will find that these Hetu destroy the internal mucosa of the Annava Srotas, and these are more prone for the ulcer situation and than the Samprapti of the first set of patients. Hope you have understood that, and I will be happy if you give your opinion of these two different set of patients according to Hetu and the Samprapti different between these two. Now, in practice, you come across a third set of patient which is also very common. They come to you that I have got problem of Amlapitta or acidity, and what is the common symptom in such patients? They say in morning, specifically in morning, I really get a pitta, a vomiting sensation. Many of them have a habit of inducing vomit. They will tell you that we induce the vomiting when the pitta is expelled out. We are very relieved, and throughout the day there is no any symptom of pitta as such. So what is the condition? They will say that we get the pitta or rulla sensation or burning sensation in the morning specifically. Some of them will induce the chardi, or some of them take medicines and they took for a long time, almost daily also. What is this samprapti? Now, the samprapti, first samprapti which is given in the text, Agdimandya Amotpatti, is not seen because throughout the day patient is happy, he is eating well, and there is no problem with the digestion or no any other symptom of Amotpatti. Of course, if the Pitta Ahar is there, they will get some Amlapitta like symptom, but it is not so much intensive, and they get even with some Ahar Vihar, Pathyagar they will get relief immediately. So, Agdimandya, Amotpatti, fermentation of food, all these steps of Samprapti of the first set of patient are not seen, so it is kept aside. Second group of set of patients what we discuss, Tikshna Ushna Ahar, and they get burning and Daha, and they go to they are prone to the ulcer situation. These symptoms are also not seen in such group of patient. Then what is the samprapti and how you will evaluate this type of patient which get this vomiting sensation and sometimes chardi also in the morning specifically? This symptom aggravates with apathya or jagran etc. But in morning, if they induce Shardi, they are relieved because Pitta is expelled out. Otherwise, they take some antacid or some medicines, Shamana Chikitsa, and by that also they are relieved. And there is no as such problem throughout the day. Now here, Pitta Prakop is there, symptoms of Pitta are clearly seen. What is the samprapti of these set of patients? Now see, there is a rulla sensation, a vomiting sensation, and patient will specifically tell you that there is something coming out, is a sensation in the morning, and I really feel that it should be expelled out. Sometimes burning is there, but not so much. Only vomiting sensation is majorly seen. So, this is Pitta Prakop, no doubt, but in Samprapti, I will mention it as Pitta Vruddhi. It is the Pitta Vruddhi. And by which guna this Pitta Vruddhi is there? It is because of Drava Guna. And because of Drava Guna, you will find that patient tells specifically that something is coming out, sensation is there, rulla sensation is there, and that Drava Pitta when get expelled out of the body, patient is relieved immediately. You will, as I said, you will not find Agdimandya Amatpatti in such patients because throughout the day he is eating well. You will not find severe burning after food, before food, throughout the day is also absent, and hence, though patient comes to you with the labeling Amla Pitta, because in common language their diagnosis is right by their way, it's acidity only, but the Samprati remains the Pitta Prakop, and Pitta Prakop is by Dravaguna. Always remember, Vata Prakop, Kapha Prakop are generalized term. You have to calculate which guna specifically is increased. For example, in Parkinsonism, Chala guna is increased. In the Padadhari, Ruksha guna is increased. Same way, in burning, Ushna guna is increased. In Rullas, Drava guna is increased, and you have to give the treatment opposite to that specific guna. Hence, early in morning, vomiting sensation is Pitta Prakop by Drava Guna of Pitta. Drava and Saraguna. Pittam Sasnya Tishnosham Laghu Pistram Saram Dravam. So, this is the clinical evaluation of such set of patients. It is very commonly seen in the Pitta Prakriti patient because they already have dominance of Pitta dosh in their body. So, this is the third set of patient which we commonly see in our practice, and the Samprapti is totally different from the first two set of patients. Please share your opinion sorry, on this all three set of patients which I have discussed with you, and I will like your experience also on the background of these three different sampraptis which come across under the topic Amla Pitta. Thank you very much.